Hello, fellow HIM 5363 students. My name is Sean Weber, and I will be presenting today on the benefits of data analytics in healthcare. A little bit about the order of today's presentation. We will start with the objectives, go into the introduction, go through the benefits of data analytics, then dive into population health and decision making, followed by supply chain management, then the healthcare payer, healthcare consumer, then go into how data analytics and HIM are tied together, and then we will conclude. The first objective of this presentation is to describe the benefits of data analytics in healthcare today and in the future. The second objective is to describe the uses of data analytics in decision-making in population health. The third objective is to explain the different methods of application of data analytics in supply chain management and finance to become a more effective and efficient healthcare organization. The fourth objective of today's presentation is differentiate the uses of data analytics between healthcare payers and consumers. And finally, the fifth and final objective is to relate data analytics to health information management profession. So what is data analytics? According to Oakes and Waters, data analytics is the art of examining raw data in an effort to draw conclusions or to answer a question. What does the flow of data analytics look like? The flow starts with data itself. That data can then be transformed into information, which finally can then be put into a way to visually represent the data and can become knowledge. So if you look at the pictures off to the right, it starts out with just an Excel sheet, which was pulled from a database. Then using VLOOKUPs and other ways to kind of tie information together, you can then create a pivot table. So what the pivot table there is telling you is you're actually getting the dollar value per order when looking at couriers, which doesn't tell you a whole lot. It gives you some information, but you can't necessarily make calls based on that. But what you can do is then you can visually represent that in a chart and trend it. So those two lines are actually comparing two different couriers and the prices between the two. So as you can see, the blue courier is a little bit more expensive than the purple one. So just based on price alone, we would go with the purple one. And that's really what data can transform into, is knowledge and help you make decisions. Some benefits of data analytics as far as today goes: population health. For population health, you can capture and report on healthcare data used for public health purposes. Decision making, there's decision support systems that gather data from sources to assist providers in making outcome-based decisions. You can use data analytics in supply chain through gathering and analyzing data on utilization. Organizations then can make future projections of utilization to assist with financial decisions and contract negotiations. Healthcare payers use data analytics. Healthcare payers can aggregate data based on similar operations and procedures and base reimbursement off of average length of stay, average cost, and outcome measures. Precision medicine, which is tailoring medical decisions to individual characteristics of healthcare consumers. And what does data analytics or the role of data in healthcare play in the future? One is IBM Watson, which is a comprehensive data that kind of houses all of this data to assist providers in making decisions. There's blockchain, which is an efficient data accessibility for the patient and for the provider. There's also the Internet of Things, and this is the connected devices that connect to other data capturing systems to assist in health monitoring. An example of Internet of Things is wearables. So when you wear a watch, for instance, it can tell your heart rate, your blood pressure, and that information can be monitored at all times. We'll then move into data analytics, decision making, and population health. So for decision making, I have a clinical example, which is the decision support system, and that's a system that houses and models data in a usable format to assist providers in outcome decisions. A non-clinical example of data analytics is establishing incentive programs based on relative value units per provider in comparison to national benchmark. So for each one of the codes, whether it be ICD-9 or HCPCS codes, those actually have, through CMS, they assign RVUs. And what an RVU is, it kind of talks about how much effort or money was expended into a procedure or operation. So you can actually kind of build those procedures into numbers. And when you aggregate those numbers, you can then compare it to an organization such as MGMA, which produces benchmarks that median providers should be meeting. So you can actually tie incentives to that metric. For population health, according to Two of our professors. Actually, population health pertaining to HIM is through analyzing and building reports based on data that can be used for public health purposes. This data can be utilized to track and trend infectious diseases, immunizations, and other reportable diseases as mandated by law and statutes. And another big thing for public health and for population health is epidemiology, which is basically the study of disease prevalence and progression. And public health data can also be used to study disease prevalence and progression in different geographic locations in an effort to minimize or mitigate disease outbreak. This is really big with the CDC, which is the Centers for Disease Control. Data analytics supply chain. Supply chain management systems allow for the capture of data revolving around the utilization of different materials throughout the healthcare organization. Additionally, the supply chain management system can be a central location for all products used within the healthcare organization. This data can be analyzed to determine ordering and usage pattern by different providers, and the data can then be benchmarked against other providers of the same specialty. So for instance, one surgeon could be compared to another surgeon. If the outcome among the providers is similar, but the cost is different, there can be a strong case for standardization of products used during procedures. So an example of this, if one surgeon was using a certain type of cement in comparison to another surgeon, however, Surgeon A's cement costs $1,000 per procedure. Surgeon B's costs $2,000 or double the price. However, if their outcomes are similar, that's a strong case to then go to ask the surgeon that's using the more expensive cement and say, hey, based on the data, your outcomes are similar, however, your cost per procedure is actually double. And this will really help with incentive being value-based, or with reimbursement being tied to value-based. This will actually help you kind of track and trend that as well. And the second portion of this, you can also use data analytics when comparing different vendors or when negotiating contracts. Having a firm understanding of the amount of products and the costs associated with these products is a great opportunity for healthcare organizations to become more effective and more efficient. How often are we using certain types of supplies? Could we bundle these supplies? Would it be cheaper to start ordering through vendor Owens & Minor because they give a discount when you order 7 or more per month, and right now we're using 6 or 7, so that might be a good idea. Data analytics, moving into healthcare payers. The paradigm shift away from fee-for-service into value-based purchasing has dramatically increased the importance of data analytics from both a payer and provider perspective. The Centers for CMS, or the Centers for Medicare and Medicaid Services, CMS, Readmission Reduction Program is now tying reimbursement or lack thereof to readmissions. This, if you're an organization, you are now required to move past only analyzing claims data, but we must take a more holistic approach in forecasting reimbursement. So previously, it was tied to a fee-for-service. If we provide this service, we have this fee associated with it. It's pretty cut and dry as to what we're getting reimbursed. However, now you could provide that service, you could get reimbursed for it. But if they readmit within 30 days, normal times, you're not getting a reimbursement for that, at least not the full amount. And that total is aggregated at the end of the year. So you could actually take a hit for the next year as to how much money you're making, or a percentage thereof that you would be making. One of the few suggestions for accomplishing the most out of systems implemented within a healthcare organization is to select a vendor that will continuously support the data infrastructure within the healthcare organization. Moving next into healthcare consumer. Healthcare consumers now have more information available to determine which organizations meet their specific needs. An example of a source that provides this information is Leapfrog. So Leapfrog is it's a survey that healthcare organizations can participate in. It's not mandatory. The Leapfrog criteria involves submitting a plethora of different data metrics, which Leapfrog uses to assign an overall grade to the organization. An example of a metric that Leapfrog utilizes is the Computerized Decision Support System, CDSS. Organizations must track their data pertaining to the effectiveness of CDSS in order to maximize their score on the metric. So this year, when we did the Leapfrog project with University Health, I was actually involved in this. And a lot of the questions are similar as far as if a patient presents this type of ailment and you give this type of drug, would you do it? And basically, looking at the patient's history, if the patient had already been given ibuprofen and then they asked for Advil 2 hours later, the system is supposed to kind of ping that or set an alert saying recommend dosage is too high or adverse based on allergies. So data analytics in the HIM profession. With the advent of the electronic health record, health information management professionals have been utilized more for data reporting. This trend is projected to increase in the upcoming future. According to Sandeffer and Mark, and a survey of more than 3,300 HIM professionals, skills in data analysis were ranked among the top 5 most important for future HIM practice. Additionally, HIM professionals are being utilized more and more in establishing data infrastructures within healthcare organizations and for establishing policies regarding establishment of infrastructure. If you have any questions, first and foremost, thank you for viewing my presentation. Please write them in the forum. I will respond to them as timely as I can. Here are some of my references. Give you a second to take a look at that. And thank you again for viewing.